What has happened now is that the public has been incited by the Prime Minister to go out and shop, drink, eat. And then, oh dear me, it's all gone to the dogs. And then to turn around and then blame the other. In the past, it was usually Jews, but now it's going to be the Muslims. Blame the other, never take responsibility for self. And this comes from the very top, from Boris Johnson. He walks away from problems. He walks away from marriages. He walks away from children. He walks away from disasters. He just walks away, leaves somebody else to clear up the mess. And that's what he's done with this. I mean, what he thought was that by drawing a line under the epidemic and Parliament breaking up for their summer holidays, they could hope that by the time Parliament comes back, everybody will have forgotten that we'd had 70,000 deaths of people, so many of them avoidable, and that then, if this thing came back in the autumn, he could then blame the public for not being sensible and doing the right thing, and conveniently overlooking all the mistakes that were made, particularly in February and March, particularly the late lockdown, particularly the failure to get on top of testing, tracing, isolating, particularly the failure to get on top of personal protective equipment, and the mistakes that were made about discharging patients from hospital to the care homes, causing this second epidemic in the care homes. What he was hoping was by walking away, going on his summer holidays somewhere nice, they could come back and everyone would have forgotten about that, counting on people's short-term memory not being very good. Well, you know, there is news for the Prime Minister. Most people in this country don't have dementia, and most people still do have short-term memory. What is so shocking and obscene about the Prime Minister claiming that we've had a massive success? What we're talking about here is 70,000 lives cut short. And the language he's using is very much like the language that President Trump uses. This wonderful, greatest country in the world, doing better than anybody else. It's everybody else's fault. It's China's fault, or it's the European country's fault, or now it's the young people's fault, because the young people have been totally confused and led down the garden path, and when they're all out drinking and all the rest of it, it's their fault, because the example that was set by significant people, by him himself not taking personal precautions in terms of his hygiene, in terms of Dominic Cummings bashing off to Durham and to Bishop Auckland, the examples that were set, and then coming back and saying, we've done brilliantly. I mean, the man is deluded if he really believes that we've done brilliantly, if we've done a great job. Lobbing money at fast food outlets. There's a multi-million pound enterprises like McDonald's and Burger King and all these places that have made fortunes out of obesity and diabetes. It's just mind-boggling. This is an opportunity to change the way we eat and the way we live towards a healthier diet. If there's going to be money to subsidize commerce, it should be subsidizing the right kind of commerce that we want to see coming out of this to tackle the problem of obesity. We don't solve the problem of obesity and the risk factors for dying from coronavirus by encouraging people to eat burgers. That's not the way to do this. The Prime Minister has admitted his own obesity problem. I think he was 17.5 stone at the beginning, and he's down to 16.5 stone. He's not going to carry on losing weight if he's going along to eat McDonald's and other burgers and all the rest of the junk food. We need an example set about how you do lose weight by eating a proper healthy diet. Now, what has happened now is that the public has been incited by the Prime Minister to go out and shop, drink, eat. And then, oh dear me, it's all gone to the dogs and it's become chaotic. And you've got lots of young people, like in the pub in Staffordshire last week, 300 people cheek to jowl, and now you've got 19 cases in the group that were there, and they're having to do the contact tracing there. And then to turn around and then blame the other, people who are different, people who are from outside. In the past, it was usually Jews, but now it's going to be the Muslims and Eastern Europeans and Spanish, because Spain's had a resurgence or whatever. Blame the other, never take responsibility for self. And then the contrast with the funeral of Jackie Charlton, large numbers of people following the funeral cortege. Jackie Charlton was a great footballer, very important in the life of Leeds United and in the history of football in the north of England. Important man, but it needed to be done properly, and in the same way that the faith communities, by and large, have been very responsible about managing congregation, which is a big thing for most of the faiths. There have been issues with different faiths, but by and large, they've been very good. I mean, I've been in contact with the Liverpool faith communities about how they've handled it, working together interfaith across the city. So it is outrageous to point the finger at citizens of ours from a Muslim background who we need to protect, we need to work together. And don't forget that over 500 doctors and nurses and healthcare workers, many of them from overseas, many Muslims and other faiths besides Christian faith background, have died working in our hospitals to save our people from the coronavirus. This issue of blame now being freely sprayed around, blaming our Black and Asian and minority groups and other groups, blaming people for their own lifestyles and so on. This was always going to be a possibility. History teaches us that when countries are in trouble, these are the times when victim blaming comes to the top. This is when in Germany in the 1920s and 30s, we saw the rise of anti-Semitism. These are the conditions under which those kind of things can bubble to the surface. In any country, in any place, they can bubble to the surface. To prevent that, it requires real leadership. It requires leaders who say, we're on this, it's our job to sort this out, we're going to take you with us, we're going to do the right thing, and we will take responsibility for getting it right or getting it wrong, because that is what leadership is all about. And that is exactly the opposite of what's been going on since February. It's interesting that Sir Paul Nurse, today chief scientific advisor of one of the major research institutes, he has called the government out on this today, talking about the lack of transparency, the breakdown of trust. It's something that I've spoken about here before. If you don't occupy the leadership position that you have desperately wanted so much, as Boris Johnson wanted that leadership position, if you don't occupy it and take responsibility, then all this other stuff will come flooding out. We're seeing now a rise, a resurgence in street violence, in knifings and other kinds of incidents, as the solidarity that we experienced from the lockdown onwards until July, as that solidarity has broken down, and the frustration and lack of direction of young people is becoming evident because of the lack of leadership, the lack of trust. And it's absolutely vital that we get a grip on this now. We've got another 4 or 5 weeks of the school holidays. We've got lots of young people out and about. We're going to move now, with the end of furlough in the last couple of days, into large numbers of job losses. We're heading towards an autumn and a winter where we probably have 3 million unemployed. We're going back into the 1980s. When the drugs problem took off in this country. That was the root of the drugs problem, was large numbers of young people with nothing to do and drugs freely available. That's what happened in the 1980s. And the violence that goes with that, apparently SAGE, the government's advisory committee, has been receiving papers predicting that we may be going to have trouble on the streets, that the police need to get ready. So, what we really need here is a government which grows up and takes responsibility for leading and not behaving as truculent adolescents and expecting the public to behave as adults. What we're seeing now with this unhelpful intervention yesterday by Sarah Vine and the reports around the country of people being really quite stroppy sometimes about not wearing masks and so on. I think you can take this all back to the breakdown of trust that followed on from the Dominic Cummings affair. And I think since that time, everything's crumbled, and the chaotic messaging from government, just throwing in one thing after another about encouraging you to go and work in the office or go out drinking or go eating, and then, oh dear, it's all your own fault if you haven't done it right, and then somehow trying to pull things back again as we've realised that this virus has not gone away in this country. The number of deaths around the country is running at about 100 a day, over 4,000 new cases a day. We've now got multiple outbreaks in different towns and cities around the country. It's a really dangerous situation, but what we've got is this now breakdown in solidarity, which was so good at the beginning after the lockdown. And it's really not helped by somebody like Sarah Vine with the profile she has, being the wife of Michael Gove. I mean, it harks back to the Margaret Thatcher thing about there's no such thing as society. We're all a set of individuals. And what we can see is that there've been 20, 30,000 deaths of people before their time, more probably now. The total number of deaths is running probably around 70,000. Sarah Vine can say that for herself. Sarah Vine's entitled to speak for herself, but she's not allowed to drag everybody down with her into this gutter of no such thing as society, because every death belittles each of us. No man is an island. Each person who dies is somebody's spouse or partner or grandma or grandpa or brother or sister. Yes, so some of those folk might have died in the next few months, but they still had a life to lead. They still had love to give. They still had love to receive. They were still important in people's lives. I mean, this is a kind of brutal thing to say from Sarah Vine. It's not a humane thing to say. I'm shocked. I mean, I would hope that her husband might dissociate himself from her comments, as he's a member of the government. Is this a government position? Does this hark back to herd immunity, letting it rip? I mean, it does seem that lurking in the background of all of this, because of the chaos of the last month, 6 weeks and so on, and particularly since July the 4th and Independence Day, that the only logical conclusion is that this strategy is about herd immunity. It is about letting the virus run its course and hoping that the antibodies will turn up, or the treatments will turn up, or that the vaccine might turn up, when we've no real reason to be confident that any of these things will really happen. And what we've got to do is change the way we live. And changing the way we live may be for another 6 months, it may be for another 2 years, or it may be forever. Now, there are some indications that we are going to be changing the way we live. I mean, I've been reading on the economics pages of the major newspapers that they are now saying, the way people conduct business now is changing, and it will have changed. And it looks as though maybe 30% of workers may not be going into an office in the future. People may be working from home in the future at that kind of proportion. It may be 20 or 30% of work days are no longer work days in a workplace, but maybe work days in a home location. Now, the impact of that on travel to work, on transport, on trains, on buses, on local businesses, on the amount of office space that's needed, on property values. We're going to see a crash in property values in the business districts of the big cities. There's some huge problems that now need to be confronted and addressed by government to reshape how we live our lives. And I would predict, as we see and we read in the property sections of the papers, this flight from London to the countryside and to the suburbs and to the market towns, that the hollowing out of the cities, the rethinking of the nature of cities, perhaps to be networks of urban villages, which was always a possibility, but to make our cities much more livable, sorting out the space needs of families, having proper sized apartments and houses and access to the outdoors, access to balconies, access to parks. Big questions now for town planners, big questions for house builders, for developers. Where is the government on this? We need to be having these conversations. All we've heard was this Gadarene rush, like the swine, to get back to business as usual, when there can't be business as usual. Business is going to have to be different. Now, whether it is completely different or whether it's only 20 or 30% different, I don't think we're going back to business as usual. I think it's going to be different in many ways. And we need to get our heads around that, because this virus is among us. It's just like February, March. There are as many new cases every day as there were when we had lockdown. We've made some progress in handing over elements of responsibility to the local public health teams. We still haven't sorted out the testing properly. We need to have many, many more tests available every day and to be carried out every day, and to turn the test results round in hours, not days, so that people can go about their business, but safely, and still having concern about covering up their faces, about hygiene, and about the mixing and so on. So at the moment, we've seen in the last week a sense of panic gripping the government. Daily, we've had random decisions being taken. You know, can you open a bowling alley? Can the women go and have facials? No, changing our mind on that one overnight. The shambles over the way in which the Muslim community is being treated over the Eid festival, just hearing that it was all off in a tweet late at night on the night before the Eid festival. This is no way to create trust with communities in this country. We have to behave properly towards people. And there's still no sense that that penny has dropped with the government. I mean, one of the puzzles about science and rationality in everyday life is that there does seem to be a proportion of the public, it seems to be about 20 or 25%, who are superstitious, who will believe that vaccines are dangerous. There seems to be this proportion of people in the population. Now, how do you deal with that? How do you take people on that journey to realize that these are real threats before it becomes really very serious? We have to show by example what to do. We have to show by example the measures about hygiene, the measures about distancing, and we need that from everybody who's in an influential position. I think when it comes to that appalling bully of a man that was in the shop and that's on the video that's going viral, who bullied this young woman shop assistant.
Are you forcing me to wear a mask? Are you asking me to wear a mask? Excuse me, why are you getting stressed out for? You've just approached me with a mask and said, would you like to put this on? Why are you getting upset for? I would suggest you go and calm yourself down outside and relax. Don't come to customers and tell them what to do with shopping. Thank you.
This is atrocious. He needs to be shamed. That behaviour is totally unacceptable. Where we need to be now with masks and face coverings, and remember, we've lost 2 or 3 months on this because of the government's refusal to embrace this, and because of the mealy-mouthed approach by the government advisors to this, where they wouldn't embrace it themselves. If you want a sharp message, as the political advisors want, is that face masks and coverings are the new condoms. Face masks and coverings are the new condoms. They protect me and they protect you. You protect me, I protect you. Face masks and coverings are the new condoms. We had the posters for the condoms at the airports. If you're going far, take some condoms with you. If you're going outside the house, you need a face covering. Face coverings and masks are the new condoms. The argument about taking away your freedom by insisting on wearing masks and face coverings in public places, I've always liked the American expression here, your freedom ends where my nose begins. I'm not going to stop your freedom, but if your freedom impacts on me, I'm sorry, that's the end of your freedom. I don't want your virus, thank you. Please cover up, use a face mask. You should not be going spreading viruses. You should not be going spreading syphilis and HIV. You should wear a condom. You should wear a face mask. Give us your ideas, give us your questions, put them in so that next time we do a broadcast, we can tackle some of those difficult issues. But in the meantime, support Patreon, support Double Down News, the future of news broadcasting. Thank you for your attention.